Hello, my name is David Magnus. I'm director of the Stanford Center for Biomedical Ethics, where I'm a professor in the departments of medicine and pediatrics. And today I'm going to talk to you about some of the basics of the regulatory system and some basic ethics having to do with protection of human subjects. If you look at the history of human subjects research, there was a very limited amount of codified oversight. That changed in response to Nazi atrocities, in which people were often treated horrifically during World War II and in the Nazi era, and that gave rise afterwards in the war trials with the first codified system of research ethics, sometimes referred to as the Nuremberg Code, which was developed in 1947 and for the first time really put an emphasis on the importance of informed consent for any research. In spite of the Nuremberg Code, most human subjects research, even in the US and Europe, actually got very limited amount of informed consent for human research trials. People began to question that. Helsinki, the first code of ethics, really revisiting Nuremberg and arguing for independent review, came out in 1964. Henry Beecher, in a New England Journal of Medicine article in 1966, did a review of a bunch of prominent published clinical trials and found that informed consent was actually very rare. And then, of course, there was the revelations of the Tuskegee syphilis study that took place from 1932 to 1972, in which African American men were denied antibiotic treatments and were lied and told that they had bad blood and needed to come in for quote-unquote treatments when they were really getting spinal taps for research purposes in a natural history study. In 1972, those atrocities were revealed, and in response to Beecher and Tuskegee and all of the concerns that people had about research, there was a presidential commission formed that gave rise to a very famous report that was written in 1978, published in 1979, called the Belmont Report. And that report, in turn, became the basis of the current regulatory system that we have in the U.S., sometimes referred to as the Common Rule. The version that we currently have was modified in 1991, but a new version, slightly modified, will take effect starting in January 2018. The basic ethical framework of the Belmont Report, which is the framework for our current human subjects protection system, it really relies on these three different principles. The first is respect for participants. That includes respecting the autonomy and the autonomous decision-making of competent persons, as well as an obligation to protect those who lack capacity. The second principle is beneficence, which means both maximizing possible benefits and minimizing potential harms. And then justice, is an obligation that the burdens and benefits should be fairly distributed so that you don't get situations where those who are benefiting from the research are different from the people who are primarily being exposed to the harms of that research. The Common Rule that this Belmont Report gave rise to, more formally 45 CFR 46, created the current Institutional Review Board system. So human subjects research goes to the IRB. It developed our system of informed consent, both the requirement that it be obtained and documented. It created our system of how we look at risks and benefits, and in particular the importance of both minimizing risks in research as much as possible, and to make sure that risks are reasonable in relation to any benefits both to the subjects and to the generalizable knowledge to be produced, as well as the equitable subject selection. The ethical elements of informed consent that are required. Ethically, this is not the regulations. It's important that if you're going to get informed consent, that it be obtained from a competent individual, that there be adequate disclosure to ensure understanding, that the agent that's giving consent must be free of coercion, so that it's a voluntary decision, and then they have to make that decision and authorize whatever is going to be done, whatever interventions are going to be done in the research studies. The formal elements required by the regulations include an explanation of the research, the purpose of the research, its duration, any risks or benefits anticipated for the participant, what their alternatives are. It has to be made clear to them that they have the right to withdraw or refuse without loss to ensure that the research is really being consented to in a voluntary manner. Whatever degree of confidentiality and protection exists, and what happens if there are adverse events, including the potential for complication, and contact information in order to be able to obtain new information or ask questions. In terms of thinking through the ethics of research, a classic paper published back in 2000 by a group at NIH led by Zeke Emanuel, Dave Wendler, Chris Grady, What Makes Clinical Research Ethical? They identified 7 primary requirements in order for human subjects research, clinical research, to be ethical. And I'm going to go through each of these in turn. First is that the research has to be of value. This has been recognized by a lot of the ethics codes in Nuremberg. For example, the degree of risk to be taken should never exceed that determined by the humanitarian importance of the problem to be solved by the experiment. Helsinki, biomedical research involving human subjects cannot legitimately be carried out unless the importance of the objective is in proportionate to the inherent risk to the subject. And, of course, the common rule, risk to subjects must be reasonable in relation to anticipated benefits. These requirements really are in a way very common sense. If you're going to expose people to risk, it had better be worth it. It's got to be reasonable for you to be able to expose people to risk because of the value of what comes out. Resources are limited, so we shouldn't waste them on things that are of no value, and we really shouldn't expose people to harm or potential harm without very good reason. A second requirement is scientific validity, and I know there's a tendency not to think of scientific validity as being an ethical requirement, but in fact it is. It's the requirements that science be adequately done is itself also an ethical requirement. Another set of guidelines says scientifically unsound research on human subjects is ipso facto unethical, and that it may expose subjects to risk or inconvenience to no purpose. And again, a very similar justification. Resources are limited, and we should not expose people to harm without good reason. There has to be fair subject selection, and Helsinki talked about this in terms of the disadvantaged or vulnerable populations, and saying that research involving those communities only justified if the research is responsive to the health needs and priorities of this population or community, and if there's a reasonable likelihood that this population or community stands to benefit from the results of the research. It should be determined by scientific goals, not vulnerability or privilege. We shouldn't take advantage of the fact that there are certain groups who are positioned socially or economically to be able to be taken advantage of. Subject selection should be done in a way that minimizes risks and enhances benefit, and as much as possible, those who bear risk should be those who benefit, and those who benefit should share the risks and burdens of research. Belmont Report identified the fact that there are certain groups, such as racial minorities, the economically disadvantaged, the very sick, and the institutionalized, that may continually be sought as research subjects owing to their ready availability in settings where research is conducted. They should be protected against the danger of being involved in research solely for administrative convenience or because they are easy to manipulate as a result of their illness or socioeconomic condition. And in fact, research on prisoners used to be very, very common before the Belmont Report really put in many more requirements to make sure that institutionalized individuals are not taken advantage of and exploited. There needs to be a favorable risk-benefit ratio, which has already been indicated. Medical research involving human subjects may only be conducted if the importance of the objective outweighs the inherent risks and burdens to the research subjects. Risk to individual subjects must be minimized as much as possible. Benefits should be enhanced as much as possible, and benefits must outweigh the risks. And then there's a big question about whether that means to the subject or others, and there's some difference between the U.S. system, which includes taking into account the benefit to others, and some European approaches, which tend to focus on the risks and benefits to the individual participant. And again, justification includes non-maleficence, our obligation not to cause any unnecessary harm, beneficence, our obligation to act to benefit others, and the fact that we should not expose people to harm unless there's a very good reason. Independent review, all of the approaches, Belmont, Helsinki, and the Common Rule, this was not included in Nuremberg, but all recent codes really stress the importance of having this independent review process, which is represented by institutional review boards, what they call research ethics committees in most of the rest of the world. And the justification is that it minimizes conflicts of interest. Investigators may very well have bias. as they evaluate research and decisions, because they've got other interests, like making sure the research gets out, or that they get promoted, or they get tenure. And so having some independent oversight protects against that conflict of interest, while also providing social accountability through an independent mechanism. Informed consent is often seen as the key to respecting patient autonomy and responsive to the history of abuses that we talked about in Nazi Germany and Tuskegee, and a number of other abuses that were uncovered in the 60s and early 70s. And it's really the dominant institutionally, it's very dominant within our oversight system. IRBs spend a lot of time looking at and thinking about informed consent and the documents for them. However, one limitation to this, although informed consent is certainly important, and as Beecher said, something which we must strive for, it's important to note that most empirical studies demonstrate limited understanding of research, that informed consents are often too hard to read for the people that they're aimed at, and that there's often serious misunderstanding among participants. That's really common. So, for example, in a placebo-controlled trial where patients are being randomized between a placebo or an active intervention, a high percentage of them believe that the investigators or the physicians are deciding that they're getting the active control because that's what they really need. And some work by Paul Applebaum found that about 30% of participants in placebo-controlled trials were under the misinformed sense that they were guaranteed to get the active intervention, because the decision of what they need would be decided by the investigators/physicians. In addition to informed consent, there's the importance of respect for subjects, and that's manifested through the importance of managing information to protect privacy, allowing participants to withdraw from research, informing participants of new information that is discovered that bears on their decision to participate, carefully monitoring participants to maintain their welfare, and mechanisms to inform participants of what was learned. Together, these elements, that research be of value, that it be worth it to do the research, that the research be scientifically valid, a fair subject selection, a favorable risk-benefit ratio, so even if it has value, if it's too risky relative to that value, you can't do it, the importance of independent review and oversight, informed consent, and respect for potential and enrolled participants, all of these things together are the keys to making sure that your research is being ethically conducted.